My name is Daniel. I live in Long Beach. I'm 30, and I have severe psoriasis. My psoriasis covers about 85 to 95% of my entire body. Psoriasis is an overactive immune system. It thinks that I'm a virus, basically. It first started when I was 12 years old, and it's extremely painful, and it grows incredibly fast. There's a splitting that happens every time I move up and down due to the platelets. Platelets are parts of the skin where my body is developing skin cells faster than normal, so they just build up into these solid silver scaly lesions. My access to medicines has been restricted by my insurance, so I have to use whatever over-the-counter I can. It's almost not worth it. I've tried, but it doesn't help something this severe.
1, 2, 3, 5, 6. Yay!
I have a wife, Amy, and my daughter, Scarlett. It crushes me when she says, like, Dad, play with me. And I have to tell her, I can't.
Careful, Scarlett. Be careful, you want her daddy.
My joint pains are connected to my psoriasis. When I have a flare-up or I'm anxious or nervous, it actually hurts me.
It's okay. Daddy, play later.
My shedding is terrible. If you collectively bring all the rooms together, a pile of skin, like an entire me. I can't sweep up after my own flakes, and that falls on the shoulder of my wife, because if I sweep, I'll leave a trail of dust behind me. It'll be a trail, clean it up, and another trail.
Well, I feel like if we can get your condition stable enough, the financial stability will follow that.
My wife and I had a cleaning business. We were doing phenomenal, but my psoriasis got so bad, it was really counterproductive to even have me in there. When you wash a wall and the skin goes on the wall. So I tried where I could, but my wife had taken it all on her shoulders, but that was too much. So we reluctantly had to just call it. Today I'm at Dr. Lee's office, and I'm hoping that Dr. Lee will be able to do something to help me out so I don't have to deal with this. I feel like my skin puts me in a prison, mentally and physically. Definitely tired of it trying to pull me down when I'm trying to fight so hard to have a normal life. I am running out of time.
Hi.
Hi.
How are you?
Good. How are you?
I'm well. I'm Dr. Lee. It's
Daniel.
really nice to meet you. Looks like you have psoriasis.
It is.
Right? What percentage of your body would you say you have it?
About 90.
90%. Okay, let me take a look and see what you have here. You have it all over your chest and your... Okay, let's take a look. Oh, yeah. Does it hurt here too?
Psoriasis is a fairly common skin condition. It actually affects 1 out of 100 people in the United States. It is a condition of an overactive immune system, which really means that our skin kind of turns over more quickly, our skin cells, so you get these thick plaques on the skin. Daniel here has a particularly severe case because it affects 90% of his body.
Yeah, you poor thing. And you also have arthritic changes. One thing that goes along psoriasis is aching of your joints, especially at the knees. Yeah, sometimes also like the thumbs around the hands or so. It's really painful. I think that's the worst part about it now. It's been progressive. It's pretty much all of my joints, my ankles, knees. Yes, yeah, okay.
In psoriasis, people can have just skin lesions, they can have just arthritis, or they can have both. It's not uncommon to have both, and in his case, unfortunately, he has pain because of psoriatic arthritis, and he has pain and skin lesions because of his skin psoriasis.
Treatment is really dictated by how much it bothers you. It's not life-threatening, okay? But it's important to treat because it helps to treat your head, because it really is something that affects your life deeply. That's definitely true. It's consumed me. It's every chance it gets, I see psoriasis. When I look in the mirror, I see psoriasis. It's pretty much stolen my entire life. Well, we need to steal that back. So I think you need something that works on the inside, and I think it would be certainly worthwhile to use something like a biologic medication, which is an injection, but it can help the joints as well. And we might even be able to treat you today before you go your first treatment.
Sounds great. I'm excited.
I'm really excited for you too.
There's no immediate cure that I can give Daniel. I can't scrape it off. I can't pop out his psoriasis. But there are some things I can start him on that can really help to improve his life.
Let me see if I have any Cosintic in the fridge. We store it in the fridge. I mean, not in the fridge we store our, like our lunches, but in our medical fridge.
Don't accidentally bring me a sandwich.
No, if you want a sandwich too. No, I'll be back, okay?
Okay.
Okay.
This medication is really great because it treats both psoriatic arthritis and psoriasis lesions, and Daniel has both. So I think this is really quickly gonna get Daniel back to a normal life.
So what you have to do is you do it one in each thigh, each time for 5 weeks, and then after that you do it once a month.
Oh.
And so we'll see if this little recipe works for you. And I think that's really the best because it's gonna work internally, and help you internally, and that's what we need, especially for your arthritis.
What's really great about the biologic medications, he can self-administer. He can give himself the injections at home, which means that he doesn't have to have as many visits to see me in the office, and he can get better as quickly as he can.
I got some gifts for you. I come bearing gifts.
I'm excited.
I've got 4 treatments for you. That's 4 weeks. Okay, so we're gonna get you started this, and I think by the time you finish that 4th one, we should be seeing some improvements, okay? And I can't absolutely guarantee that this is gonna work, but this is our opportunity to get out of this hole.
Well, thank you. I'm excited for this whole thing.
Yeah, I'm excited for you too.
I'm not really worried that it won't work. I think it's more of a stepping stone no matter what. I think that we'll work together and we'll make sure it works.
Oh, my sweetheart.
Oh, you're so welcome. I'm so happy for you. Don't lose these.
I'll keep them next to my sandwiches.
Yeah, next to your sandwiches, yeah.
This is the beginning of my story. This is where I break off all the scales and reach for the stars, and this time there won't be anything holding me back. My self-esteem is through the roof. It feels good to be normal.
It's been 10 weeks since I saw Daniel, and his skin is looking incredible.
My chest area, my arms, my sides here, my legs, all the way down my back. It's completely smooth.
My name is Brittany. I am 30 years old. I live in Chipley, Florida, and I am covered from head to toe in cysts. I have them up here. These are the squishy ones. When they get inflamed, it feels like a hot ice pick being stabbed. I have one here. This one feels more like a sack full of cottage cheese. I have them from my torso and all the way down. It's covered. The one on my chin that hangs, stuff comes out of that one. But by popping them, none of them ever go away. It just eases the pain when they're inflamed. I was born with neurofibromatosis type 1, and majority of every day I have pain. And they're really inflamed right now. Robbie is my boys' father. He looked past my disorder from day one, and my 2 boys are just my biggest supporters. But my kids get made fun of because of the way I look. It hurts them and it breaks their heart. So I try not to go to too many school functions and stuff for them. I've been told multiple times that I look like a monster. I've had adults trying to get their kids to laugh too. I try to brush it off as much as I can, but it's hard. I get very depressed. I honestly think I'm ugly. I feel I was supposed to be in a different body and not the body that I'm in. Because the body I'm in, I hate.
Hello.
Hello, I'm Brittany. I'm here to see Dr. Lee.
Okay, yeah.
For my whole entire life, doctors have never removed anything from me, any of the cysts or anything. She's able to tackle some of the problem areas.
Go ahead and have a seat. Dr. Lee will be right with you, okay?
All right, thank you, ma'am. It would give me my self-confidence back so I can be able to pursue a better life for me and my children.
Hello. Good morning, how are you?
Good, how are you?
Are you Brittany?
Yes, ma'am.
Nice to meet you. I'm Sandra. Well, what brings you here? I feel like you have neurofibromatosis.
Yes, ma'am. I had neurofibromatosis type 1.
So you were essentially born with this,
yes, ma'am.
Correct? Okay, so you have, I would assume you've seen a lot of dermatologists and other doctors too?
All the time, and they just don't help.
So they kind of stick out more so on the surface?
I have it on the surface.
It's interesting how neurofibromatosis is so
different.
Similar yet different.
Like my mother has it more on the inside, and we both have the same type.
Yes. Okay, well, let me take a look at some of these areas.
Okay.
I don't want to promise you anything before I take a look, okay? Brittany is wonderful. And it's really shocking to me that she has thousands of bumps and she has not had a single one removed. So even in one person, things can get complicated. There are different kinds of growths that can occur. So I really need to assess what she has going on and manage her expectations. Okay, I'll start from the top here. So this one, I feel a little something there at the base. My concern is sometimes when you remove a neurofibroma and you just shave it off flat, there's still some underneath, so it will sometimes just push out again. Let me take a look at that one on your chin. Yeah, that one looks pretty straightforward though too. So I feel like if I get these ones that stick out, like here, here, and these that are really sticking out and around your nose.
That would make a world of difference, especially around my nose.
Yeah. Okay. So now we have, you can put that back on.
We have the big mama.
Oh, I said the big mama. Is that what you call it? He's cute though. It's like I can almost fit my two hands together, you know, they're touching.
Oh, yeah.
So that means that I can really kind of take this off and just stitch it. I think that would be really nice to just have a little line scar there. Brittany has many visible neurofibromas, and she knows as well as I that we can't make this go away, but I want her to feel more confident in this does not dictate her life. She can do something to sort of have some control over it. So I think that the best course of action here is to really assess the ones that are the most noticeable, the most symptomatic for her, and try to remove those. Certainly, we're gonna try to get to as many of them as I can, for sure.
Okay.
Okay?
Sounds good to me.
Okay, great.
Dr. Lee being able to do this for me means the world. I'm so excited and,
Okay, so I'm gonna numb up these bigger areas and then probably around her mouth too. Every neurofibroma is rarely unique, and you can't predict how it's gonna act. One will be like an iceberg where you just see the very tip of it, and there's a much bigger area of tissue underneath. You also don't want to remove a lot of normal tissue because you can be left with the indentation, and that can look just as bad. And you really need to be careful and conservative to try to figure out where this is and leave the proper amount of skin to try to keep this looking as normal as you can. Okay, be ready to go. Let me know if anything hurts. You did so loud.
I think the smell bothered me the most.
Brittany really is such a trooper. I think that multiple treatments she's certainly going to benefit from. So I really look forward to seeing her again, but I think she's gonna be really pleased with what we've done, certainly so far. Here you go, take a look at what we did here. Oh, careful. What do you think?
I feel like my whole life has been about this moment. It's finally happened. Can I hug you?
Oh, of course you can.
oh my gosh. I don't know rather if I should cry or smile or laugh. My shape of my face is so much more even, and I don't have anything hanging off of my chin. I already feel like 1,000 pounds have been lifted off my shoulder. It's amazing how it can happen in the blink of an eye.
I would love it if we could do a two-parter here.
Okay.
Like, I feel like we can go back and get some fine-tuning. Okay, that would be really nice. I'd be really happy to do that.
I'm happy.
Okay, good. I'm happy for you too. Okay, and so I will see you soon, okay?
Okay.
Okay.
Feel like a lot of changes are coming my way.
I've waited so long for a doctor to actually want to help me, and she's shown me a whole nother light. It's been a month since I saw Dr. Lee. I've definitely gained a lot of confidence since I've got the majority of the cysts removed that I've wanted. I can finally breathe and live my better life that I'm supposed to. It's not there no more, Preston. What do you think about it? Good. Good?
My name is Ken. I live in Polk County, Florida. I am 35 years old, and I have several cysts on my head. The cysts range in sizes from a pea to almost a golf ball. I got my first cyst when I was 19 years old. It was about the size of a quarter. I noticed it when I was putting on a football helmet, and after that, every year, every 2 years, I'd have 1 or 2 more. I have popped a few on my own. This is a safety pin I use when I pop my own cyst and press it in all the way through. First one, I was just kind of picking at it, and it kind of broke. It had almost a clay-like substance inside it. Then I squeezed really hard, and I was able to push the whole shell out. It kind of bounced off the ceiling and landed in the sink. I had another one that the wound would not close. When I went to see the doctor after I popped that, he used a tool I've never seen, almost like a human soldering gun. Thus, I have a giant crater on the top of my head with no hair. So I never went back to get more done. And when I'm combing my hair, I can feel all the different bumps that I have. The big ones, the small ones, they all protrude a little bit and can catch the comb. See, when I comb my hair down, it'll hit it here. And I can feel all the bumps, but obviously, especially the big ones. This is the largest one that can no longer be hidden by my hair. The hair just automatically parts from it. The bump, it's just very uncomfortable. And the bumps have lowered my self-confidence, so I stopped going to the gym. I'm way out of shape now. I definitely don't feel as good as I did even 4 years ago. Before the cyst got out of hand, I had much, much shorter hair. The last couple of years, my short hair couldn't cover them anymore, and they were starting to be exposed. So as I started to let the hair grow, I started to let the beard grow and attempt to cover it up. These bumps have definitely put me in a more depressed mood. It's affected my job. It's affected my confidence. I don't go out near as often. I just don't have the will or the motivation to do that at the moment. Just knowing that the bumps can't really be covered up.
What's up?
What's up, bud?
Not much. You doing anything tonight?
Yeah, this. I stopped going out near as often. I used to hang out with my friends all the time and go out drinking, and my social life has been changed by pretty much just not having one.
Need a couple guys for some drinks and some food and go play some pool later. Seeing if you wanted to go.
I'm not feeling up to it today.
A couple times I tried to get you to go out, and you just won't go. What's up?
You've seen the bumps, man. They just keep getting bigger.
I mean, he's not the same person, you know, since all this has came about. It's not something he wants to do. He doesn't want to grow hair out and look like a lumberjack and hang out at the house, you know? I know that 100% because it's not him. When I first met you, man, you always had something going on, you know? Party once a month or at least doing poker. And all of us would hang out. We just don't do that anymore. You just seem like a totally different person now.
Not like I'm happy doing what I'm doing. I miss going out. I miss watching the games, going to the fights.
What are you gonna do? Just sit around here and, you know, sulk about it and be lazy and not go out and do nothing? I mean, you're gonna have to get up off your butt and get back in gear, man.
And it's just not worth it at the moment. I am definitely nervous about seeing another doctor. I don't want scars all over my head and large bald spots. I definitely think that they're ugly. Even with my long hair, they still show through. You never want to be the guy that's getting pointed at. It's never fun.
Hello, hi.
Hello.
How are you? Are you Ken?
I
Is that
am
correct?
Ken.
Hi, nice to meet you. Welcome. So you are here because of
Several cysts.
Is there some pretty big ones that you have hidden there?
Yep.
Ah, I see that one right there. That one's got a lot of little bumps to it, huh?
Yeah. I was
Okay.
picking at that one and made it worse.
Do you mean like it bled, or?
I tried to poke it and drain it.
Okay. All right. Had another one back there. I see. Ah, okay. I don't think it's the greatest idea to remove them on your own because the pain would probably prevent you from making a large enough excision to remove it. But then the risk is bleeding, certainly, and infection. But I understand. I mean, it's been something that you've been probably feeling really helpless about. I always try to hold my tongue when people tell me that they remove their own cysts, but it's important that you don't do that because there's an absolute risk of infection, of bleed, of scarring, of this growth coming back much worse. So please keep your hands off of it. Let me put my hands on it. Well, this looks pretty typical of a pilar cyst that's just been growing. So let me see the one under here, too.
Watch out, I've been picking at that one.
I see. Yeah, you smushed this down. It's like flattened.
Then very small one right there.
Yeah, tiny one there.
And a little larger one there.
My gosh, yes you do. Yes, you have one right here too. There was one back here you were started to reach for and we got, that's a little bit of a bigger one.
This one.
Oh yeah, okay. So, you came here with a bunch of bumps.
Yes, ma'am.
I think these are pilar cysts. I'm gonna have to figure out what we're going to do here just to make sure you're the most comfortable and getting out as many of these that I can.
Okay, thank you. Dr. Lee was surprised at how big they were, and she seemed to think like it might be a little bit of a challenge for her. Slightly worrying, but we'll see what happens.
I feel like these two are the big ones that obviously are cramping your style the most. So we're gonna try to target those two here first and see how you do, and if you can, maybe try to get some of them surrounding them. Okay, let's see what's under here. Look at what we have here, a little morsels.
He had like every different type of cyst.
Yeah, you're like a Pimple Popper museum. It looks like two of them had a bunch of them, had at least 4 to 5 other extras in there.
I am very grateful for Dr. Lee. She did an amazing job. I feel like a fog has been lifted. First thing I'm gonna do once I'm all healed up is double check my gym membership, see if I'm still paying for it, and get back in the gym.
All right, take care. Now, you're not done yet, though. She's gonna put some bandages on you, okay? Thank you.
Now that I can cut my hair, I can be in compliance again at my job, and hopefully I'll start seeing the sales roll in again, and this is gonna be a big change for me. I'm excited. It's been 8 weeks since Dr. Lee's removed the cyst for me, and everything's changed. The areas where the bumps were, as far as I can tell, have been healing great.
How you been?
Been good. Let's get this done.
All right, have a seat.
My energy's higher. My confidence is back. I've been growing my hair out since these bumps started to get really big. I'm excited to finally get my hair cut and be done with this mop. Getting rid of this hair is an important next step to getting the new me going.
My name is Amber Taylor. I am from Ada, Oklahoma. I'm 37 years old. Blake Shelton, I think I can get that on for you today. Do you want to send it out to anybody? Being a DJ is my escape because I suffer with a condition that tries to steal your daily life, your joy, your hope, and who you are as a person. It makes me feel like a freak. Hidradenitis suppurativa, also known as HS, is better defined as inflammation of the sweat glands. It affects 90% of my skin that you can't see. It causes what I call craters to form. Sometimes they're the size of dimes, sometimes they're the size of baseballs, and they are not fluid. They are filled with infection. They're very painful. I have a hole right here. It will drain, and this is now tracked. Whenever these drain, it smells like rotten trash. I've had a doctor tell me that it's because I was fat. This started when I was 8 years old. I was not fat. I've been told it's because I was a smoker. I quit smoking years ago. I've been told by doctors to cut out processed food, sugar, caffeine. Nothing changed. I feel like the only person who ever understood was my mom. She fought for me. My mom took me to so many different doctors. She researched and made me try this diet or put me on this herb. But when I was a junior in high school, she went into a coma. And then when she died, it was devastating.
My mom, ouchie's getting hurt, and so
She have to take baths every night, and so she puts pads on. I wish my mom and Elsie can go away.
Hey, Noah.
My relationship with my dad has been rocky through the years. I don't think he fully understands me or my skin condition. I've got several flare-ups right now. I don't have just one. So look at this from the other day. Was that big when you were here?
I have a very hard time dealing with. I could not stomach it myself.
Why?
It's just graphic.
Rhonda is my stepmom. She married my dad 4 months after my mom died. I'm hurt constantly. It's an everyday battle.
I know how bad it is, Amber. I just don't show it. I've never showed feelings that much, and you know that.
Okay.
I knew it was a disease, and she would probably never get rid of it, and it will probably kill her eventually, unless she gets some help.
I think this is an opportunity of a lifetime. Something that I've probably waited for my whole life. A doctor who will listen and try to understand. Whereas other doctors have never cared to.
Knock, knock. Hello. Hi. How are you? Are you Amber?
I'm Amber.
Nice to meet you,
to meet you.
Amber. Welcome. So what are you doing here today, by the way?
Well, I suffer with hidradenitis suppurativa.
Okay.
And I have it pretty much everywhere you can't see.
One of the first things I notice about you is how gorgeous your skin is. Your skin
hear
and
that
face
a lot.
is beautiful.
Isn't that crazy?
And I bet you that stings a little when you hear that because you know you're hiding something. Oh, girl. Don't be like, come on, don't do that. Here, let me get you a Kleenex here. Don't do that.
Thanks.
I'm here for you, okay?
Hidradenitis suppurativa is a tough skin condition to deal with. It is a condition that is probably more common than we think because people hide it.
So these are fistulas and tracts. It's called honeycombing, where this cyst, if you squeeze it, sometimes it'll tract off onto the other side of the armpit. It's inflammation. It's the irritation of these hair follicles and these sweat glands, and that's when your body decides, oh my gosh, this is a foreign object, let me destroy it. And that's where it gets red and painful and swollen. Usually what we'll do is we'll just locally inject a little steroid in the area, and you know, that just locally suppresses the immune system there, calms it down. So we'll do that there.
I've never actually had a steroid injection into the site before. No doctor's ever offered me one.
A corticosteroid can help calm down your immune system. So if we inject it locally into an area that is inflamed or red or angry, it helps not make the area as red and inflamed. But there is a downside to injecting a red, inflamed sore.
You ready? One little baby pinch. I'm gonna wiggle you here. Okay, okay.
It hurts.
Oh!
That's it. I hate hurting my patients. But in this case, I kind of have to elicit a little pain and discomfort for her to get the good result.
Okay, ready? Little baby pinch here, pinch. All right, let me just go one more time here. Ready? Third time's right. Baby pinch. Okay, okay, pinch.
Ooh.
That's it. Just work through it. Okay, that's it. I'm done. I'm just sitting there. See how I inject right there and it comes out of that top one? Because there's a tunnel under there. All right, done.
Steroid injections are really gonna help the cysts that you have that are active, but I'm still going to look into other areas that can help improve her life.
I understand what you're going through because it's sort of like this hidden disease that you feel alone and you kind of suffer yourself because people don't know it. And it's important to have people around you that understand.
Right.
And is that something that you have trouble with too?
Yes.
Yeah.
Because you feel like you don't have a support system. And I did okay for the most part until I had a child.
Yeah.
And he has made me realize how important having support is.
Yeah.
Because I don't want him to grow up feeling that you have to be independent. There's no one there to help you.
Do you talk to anybody about this?
No.
I have patients here that have the same condition as you, and I'm gonna get you their phone number.
Okay.
we've treated them with medications and they've gotten better.
Okay.
But I think that it's really important for you to have somebody to talk to that understands what you're going through.
That would be great.
I think that would be the most special thing for you. So I already have somebody in mind that I think you're gonna love.
I definitely feel like seeing Dr. Lee has helped me emotionally. Hey, Jillian, what's going on?
Hey, Amber.
Dr. Lee wanted me to talk to a real live individual who has HS.
I really get flares if I'm like super stressed.
Right.
And that's when I know it's like, okay, I need to take care of myself. I need to like chill out.
Right. All right, girl, thank you. And I'm so grateful Dr. Lee put me in touch with her. I'm gonna get you. I'm gonna get you. But once I got the injections, it changed everything. It was a game changer. It just reduces the pain, it reduces the inflammation, it changes my life dramatically. You got it, you got it, you got it. I think if I hadn't seen Dr. Lee, I would have continued in a downward spiral.
It's just raised up skin with a benign tumor as I best can describe it. I have these cholesterol bumps on about 90% of my arms. They come up all the way up to my back of my shoulder blades. My bumps are almost mirrored. If you look at them, they're pretty much, they grow in about the same exact way. They range from the size of a little pea to maybe a small stone. Some are hard, some are soft. I can squeeze it, I can move it around, pull on it. It does not hurt any of them. When my bumps first started coming in, I was 13. It was a very tiny rash above my elbow in the back on both sides. I had biopsies done. They said it was cholesterol bumps. The normal cholesterol level for a normal human being should be in the hundreds, maybe 130, 150. Mine at 13 was 600. I've been told, medical miracle, you shouldn't be walking right now with how high your cholesterol is. So I'm even doing a little normal task, just reaching in to grab food out of the cupboard. I scrape them, and if I'm pulling down, they're getting stuff, and it's an audible sound. You can hear it. It getting caught, but tough process. I have tried to get some removed, but when I've gone to doctors, they've said maybe we can remove 3 or 4 at a time. It's very discouraging. Like at 3 or 4, all right, that's not a big difference to a major problem that I'm dealing with.
I've known Bobby for probably 23 years, and when he thinks about his skin, it's a problem. He thinks people look at him like he's the outcast. Everybody's gonna always have their eye on him, and that's not what we look at him. He's a good kid, kind-hearted, cool, calm, collected. And I told him, you're always gonna be not even a friend, a brother of mine. Don't worry about what they think. We're gonna continue doing what we do. That's all that matters. They don't pay your bills.
No, they don't.
That's it.
It's very depressing. It definitely is a feeling of hopelessness of why me? Why was I chosen like this? So it gets rough, and you just I don't sometimes know how to deal with it. Mom, what are you doing?
Picking up all the debris that has gathered around the yard from the rains.
You need help?
Not with that. This thing has to go.
That's fine. I could start cutting it down now. My relationship with my mom is great. I love her to death. She's always been there for me.
Oh, what happened?
I almost cut myself like I did earlier.
Oh, wow. Oh.
I'm kind of just fed up with all the bull I say that doesn't bother me, but does.
Oh, you're admitting that it does bother you.
You know it bothers me.
Okay. For years, you have denied that it bothers you. For the longest time, my family tried to convince Robert to go to a doctor for the bumps. He would refuse to do it because he would insist that it bothered us more than it bothered him. But people don't see Robert for who he really is. He's a great person inside, loving, giving. So I'm hoping somebody can help him.
You know it's not easy for me to talk about my emotions. I bottle everything up. From what I went through as a kid, put a wall up and shut everything down. and it protected me. I deal with it in my own way.
Yes, I know. And I'm very happy that you are doing something about it, finally. That you're taking control of your life on your own.
I haven't been a happy person in a long time dealing with this condition. Anybody that knows me knows deep down I hurt from it. And I feel like Dr. Lee can help me get past a lot of that. I love you.
Hello. How are you?
Good, how are you?
It's very nice to meet you.
You too.
Welcome. Are you Robert?
Yes.
Is that right? What can I do for you today? This must be part of why you're here.
Yes,
What's
I've been
going on
dealing
here?
with this since I was 13. They think of cholesterol bumps.
Okay, okay.
When I first got looked at when I was 13, they brought in a whole bunch of medical teams, took pictures, put me in medical books. Felt like a guinea pig like that,
Aw, so they took a biopsy, I'm assuming.
Yes, somewhere far up here. I can't see where it is.
Okay. How did that one grow back?
It did not grow back. It's a flat, just a tiny scar.
Let me take a look at it.
It should be somewhere back here.
I think I see what that is. So that looks pretty good, and it healed pretty well, huh?
Yes, that was years ago.
Okay, so first of all, this is called eruptive xanthomas. The high cholesterol, because it's in your blood vessels, it's sort of diffusing out and going into your skin.
Okay.
And then your skin is like collecting these little fat-laden cells.
Oh,
So
wow.
that's what these are. And in a way, it is very fascinating. I haven't seen this to this degree.
Oh, wow.
Wow, this is the most extreme case of eruptive xanthomas that I've ever seen. Essentially, what's happening is that you have such high levels of cholesterol, it's popping out of your skin. So all of these areas, they are filled with cholesterol. A person with this many xanthomas most likely has some internal medical problems, and that can present some really complex issues when we're trying to decide how to treat him. So let me ask you, do you have like a high triglyceride or
Extremely high triglycerides. When I was 13, they were 600s.
Do you have any heart issues?
I have a blocked artery.
So are you on blood thinners and things
Blood
like
thinners,
that?
cholesterol medicine. I'm a
Right.
diabetic.
Okay, okay. So you certainly are quite an interesting guy. I mean, first of all, you have a serious cardiovascular risk with a known clog of your artery there. And then we're gonna give you a lot of numbing medicine, which can be toxic to the heart, you know? There's a lot of things I think about, like how much are these gonna bleed? How well are these gonna heal? So that's the quandary here, and I don't know what we're getting into.
From what it was to what it is now, that is a big difference.
Yes, it is.
I look at the pile of bumps that Dr. Lee has removed. I think I see about 100, maybe a little more. I think to myself, I'm shedding myself of all this negative energy that I've held back for so long.
That is crazy.
It's just a wave of relief coming over me that this is actually happening. This actually happened.
It's been 8 weeks since I've seen Dr. Lee for my last procedure. My arms look incredible. They're smooth, and I feel like a brand new man. Dr. Lee removed hundreds of bumps off my arms. I don't bleed when I bump into stuff. There's no more pain. It's a great feeling. Before, when I used to go to car meets, I'd feel like an outcast, a freak with the way people would look at me. What's up, Rob? Nice to meet you. She's a beauty. Now when I go to the car meets, I feel like just a regular person. Bob. Zach. Nice to meet you. And just able to be myself. These are beautiful cars, guys. Beautiful cars.
My name is Natalie. I'm 28, and I live in Atlanta, Georgia. And I have a number of bumps on my legs, my thighs, my arms. Basically, it's raised nodules that are very itchy, and they get thicker the more I itch. Basically, all the nodules are a little bit thicker on the arms. They're also on my stomach on the sides. As it's gotten worse, I've went to more doctors, and I was given different topical stuff. I was given a bleach cream to bleach the spots. I've changed my diet to gluten-free. I've tried different natural stuff. None of this stuff worked. It wasn't until maybe 2017 where I decided to do my own research, and I learned that it was prurigo nodularis. When this condition started at 21, it felt like maybe it was a rash that would eventually go away. Once my arms got covered, It made me feel like I had to hide more. Other ways that I hide my skin, I sometimes wear makeup on my hands and my feet. Just basically put the foundation on to the scars. It doesn't cover them up that much. It's only like a slight kind of concealing. It helps a little bit. I have gotten questions. I was in Chicago a few months ago, and this random girl asked me what was wrong with my hands, and I don't really know when someone does ask a question, I get emotional, so I don't want to experience that emotion. So I try to just bypass all that. I'm very self-conscious of this condition. I don't want rejection. I feel like I don't really open up to people and just kind of stick to myself. And it's been very pressing on me mentally. Sorry. 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 I've had many different dark thoughts, depression, like thinking that this will never change. But I'm in a place now where I want to be brave and just kind of like let this thing not take so much power over me.
Hello,
Hey,
Natalie, right?
Yes.
How are you?
It's so
Welcome.
good to meet you in person.
Oh, I like your mask.
Thank you.
I'm so glad that Natalie made her trip from Atlanta. I was able to speak with her via video conference, which really gave me some ideas about her condition. You've actually seen people, right? If I remember correctly.
I've seen a number of dermatologists.
Okay.
And nothing has really helped.
You know, you've heard the name prurigo nodularis, and that's more of like a description of what this is, what it looks like. What they see under the microscope, what we see when we look at it are bumps that are due to a lot of manipulation in the area. Natalie is right. She does have prurigo nodularis, but that is a very non-specific skin condition. It's really a descriptive term. It just really means that you've been scratching or picking at some area chronically and causing the skin to thicken in the area. In the biopsy, they say these are most often seen from scratching.
Right.
Like it probably happens to you, I'm guessing more when you have a quiet moment and then it happens.
At night is the worst.
Right?
At night's
yeah.
the worst.
The pattern of Natalie's skin condition, her biopsy results, and also the fact that she's been itching a lot more at night really give me clues as to her diagnosis, but I really need to take a close look to confirm this. I also thought it was just really interesting that they were so perfectly spaced.
Right.
But you never have one like that's right next to the other one. I'm gonna check your back.
Yeah.
So you can reach up here?
Yes, I can reach up there.
Okay. And then how about down here? Like, do you get you don't get anything on your lower back
No,
here,
like
huh?
by my bra strap, there's probably none.
Face, you
No,
avoid,
no.
yeah? Something that I'm noticing is the distribution of the bumps. Why do you not see that on her back, but you see it on her arms and her legs and her torso? I think there's really one option left. If you didn't scratch at these areas, do you think that they would not appear?
Honestly, I think there'd be something. Yeah, I try to not itch, but there's some kind of sensation that's causing it.
Right.
So that's why I don't know what's triggering that.
Yes, sometimes we don't know the answer. We
Right.
don't know why, but I really think it's in your mind. Like obsessive compulsive condition where you feel like you feel compelled to pick at something because something about it bothers you. So we just need to try to stop that kind of compulsion to pick.
I definitely don't think it's that. So I don't know.
I totally believe that there is itchiness there. But I think if we can train your mind to not pick at it, that would be the way to get to the bottom of this. Is there a way that we can block you from scratching?
Right.
I'm gonna try different things on you.
Okay.
We're gonna decide this together, okay? All right,
I'm excited.
I'll see you inside.
Okay, see ya. It freaks me out, the whole like OCD thing, because I'm like, no one wants to believe that they have like some kind of mental situation going on. There's still so many unanswered questions regarding it, so I'm down to try whatever to figure this out, and hopefully she has the answers.
We're gonna try some different things. So, have you ever used anything called Cordran tape?
No, I don't think I have.
Okay. I've given Natalie a special tape that's really impregnated with strong topical steroids to really serve in two different ways. One is to increase the penetration into this thick bump so that we can help shrink it. And the other is by covering it with tape, it helps to keep you from picking at it. And then maybe be like, we'll do that one.
Okay.
And I think that steroid, too, can help decrease the feeling of that itch, you know? And then, lastly, we have this. That's why I have Valerie here. She's going to do what's called an Una boot, because we use it sometimes on people's legs. It's kind of like an ace bandage cast. We wrapped a part of your left hand, and we left it there for a week. What do you think?
Yeah, I gotta see.
Because if you could do it for like 3 weeks straight, I think you could see a potential result there.
Awesome.
Because a lot of times, the more you scratch, the more it itches.
The more crazy it gets.
So we're trying to break that too.
Yeah.
Natalie is caught up in this little vicious cycle here. So I really need to disrupt this cycle to make way for healthier behavior and healthier skin.
So it's just this little medicated thing.
Yeah, so like with the whole OCD thing, just hearing that, like oh
Yeah,
God.
no. It's sort of like an OCD in the terms of not a diagnosis. Sometimes people have a compulsion. You cannot physically stop scratching it. I know that it's very confusing and a little scary, and it's normal to get a little defensive if a doctor may say that you may be part of the reason that this is happening. The first step is accepting that, and I hope that she can. What do you think? Do you think it's gonna be possible?
I think
you're
it's
willing to
something
try
I'm
it.
gonna try it and see what happens.
You like challenges, I feel like. You can do it. You're an independent woman. Okay?
Thank
that
you
might
so
work.
much.
You're welcome. I'll see you.
I do still feel like some kind of underlying thing that's causing me to itch, but this is just, one more road to go down to see if it'll help.
My name is Bob. I'm 67 years old, and I have these mystery spots all over my body. These sores are on my forehead, cheeks, stomach, right and left arm, and my legs. Fortunately, I have never had them in any of the nether regions. The first sore popped up around 2015. I fell, had an accident, broke my arm, and I had a huge infection. I fell on something that transferred to my skin. I believe that it is a live organism that travels through my body to propagate. They literally make little tunnelways. I've been to 7 skin doctors. My first dermatologist stated that I was suffering from something called parasite psychosis, which is imagining that you have something crawling underneath your skin that would cause you to scratch, itch, and possibly even cut your skin. Hearing this doctor and others that followed him say that you don't have all your marbles, that you're not all here, is very aggravating. They seem to have a preconceived notion about people who have marks on their skin, that they're doing it to themselves, but there's absolutely no way. When every single doctor that you look to help you, to save you, they refuse to do anything. It makes me lose faith in the medical industry. I don't necessarily feel hopeless, I feel helpless. This skin condition affects my relationship so much. I have not been in the same bed with Lauren in over 7 years because if this could be contagious, I can't risk her getting this. This condition has taken away the tenderness, the intimate life, and that's more painful than these sores could ever be. The longer I go with no answers makes me very upset. I have never had any kind of mental health issue, so I hope that Dr. Lee can take an honest look at my skin and try to fill in the blanks.
Well, hello. How
Finally
are you
get
guys?
to meet
Oh,
Dr. Lee.
Uh-oh. How are
I've
you?
heard so much about you.
It's very nice to
Oh,
meet you, sir.
We're a bit.
Nice to meet you,
Nice
too.
to
Aren't you lovely? Who is this? Is this your better half?
This is my girlfriend of over 23 years.
You're Bob, okay.
Yes.
I see your arms look like they're all beat up. What's going on?
Well, I broke my arm,
Yikes.
and when they changed the bandages, the nurse that came said, you have a bad rash or an infection.
When did this happen? How long ago?
7 years ago.
7 years ago, okay.
it has spread and spread. I believe it's maybe a parasite that had gotten in there, like what dogs would get, animals would get, like a skin mite, where it gets into your skin, it irritates.
Well, you know, humans get mites too.
Sure.
There's scabies, which is very specific for humans.
I've seen countless dermatologists. Everyone has told us this is an imaginary type thing. Well, it never goes away.
Okay. Bob and Lorna, they're such a sweet couple, and they've been dealing with this for a while, 7 years, dealing with a mystery condition. Sounds like other doctors have dismissed his condition, but you know, people can have parasites living on their skin, and that's part of dermatology. Let me see your arm, because usually if we look for scabies, if we look for mites, we see like burrowing. We usually look for them around the wrists, that's where they hide. Actually, the inside of your wrist is really nice and clean.
But it looks like the shapes have moved or tunneled.
Okay. Can I lift up your shirt
Sure,
and
go
see
ahead.
your back?
Go ahead.
Oh, look at how pretty your back is, though.
Oh.
That's how his skin used to be.
Your back looks really good. After taking a look at his skin, I can rule out scabies because usually you present with a rash in particular distribution. But there are some signs and symptoms that he's showing that makes me think and look in a different direction. I know, you know, you feel that there are parasites there, but I don't really have any evidence of that.
I would love if you would just put it under a microscope to see if there's a organism that is in there. That's all that I want.
That's all he wants.
Yeah, because if you say
we can
there's
do that,
nothing,
but what if I say there's nothing there? Okay, well, let's try that then.
Okay.
Okay, you can look at it yourself and see what you think.
Dr. Lee says you're scratching it or you're itching at it, but she's going to actually take a sample and put it under a microscope.
All right, have a seat. Dr. Lee will be right with you, okay?
I hope that Dr. Lee can see what I see on my skin.
Which one do you think would be better for us to maybe see something under the microscope right away? The one on your right upper arm, that one looks fresher?
Yes, this one.
Okay, so this one here, though, we're gonna send for biopsy.
Okay.
Bob insists that he wants me to look at a skin sample right here, right now. Even though I'm not suspicious that there is a parasite here, that might be helpful for two reasons. First, taking a sample might give us a diagnosis. There are some people who know their own skin better than anybody else. And also, it will make Bob happy. He will know that we're trying to find an answer here. I'm gonna take a couple samples here. One of them I'm gonna send for a formal biopsy just to get a dermatopathologist's read on this. And the other one, I'm gonna take that piece of tissue and just put it under our microscope here. Now I'm gonna place the sample on a slide and go over to my microscope so I can take a good look. Okay, let me hold this up here.
No other dermatologist has ever done what she's doing right now. And I can't wait. She will see things that probably blow her away. There will be hundreds of these little parasites crawling and glisten.
Okay, so I have a little video of it.
Okay.
I mean, that's like a little hair I see. There's a little blood there, of course. There's nothing moving in there. So just a lot of...
Okay, well, what would that be right there?
Right. It could be dirt, you know, it's not like there's eyes on it, or I can't say that that is anything.
Okay. Looking at this sample, it does not give me closure. To me, it's hard to actually discern what is in and underneath that slide. But Dr. Lee did something that no other dermatologist has ever done. So I thank her so much for that.
I'm gonna send this biopsy in. I'm gonna tell them to look at it and see if they see anything, and let's see if we can come to some more answers for you here, okay?
Okay. I really want to hear from her. Hopefully, something will come about with the results that come from the biopsy. Maybe some medication that she can prescribe, or different types of treatments or techniques which will help.
My name is Monica, and here I am back at Dr. Lee's office. I was at Dr. Lee's office a couple months ago, and she tried to remove my birthmarks off of my face. I've always had this birthmark my whole life. The medical term for it is nevus sebaceous. It started really small. Probably it was about the size of my index finger. I was bullied as a kid. You know, people telling me I look like I had a pepperoni pizza face. Once I've reached puberty, it got worse. I've had plastic surgery, dermabrasion surgery, laser surgery, but it's always come back. I gave up. Just live with it. And so that's basically what I've been doing.
I think that it would be nice to try to shave some of this down as much as you tolerate. So I'm gonna use an electrosurgery tool. It'll cut it off, but it'll also cauterize it.
I have not had that done.
Yeah,
before.
so hey, let's try something new.
Yay! I would try to deal with the pain and put up with the pain, but it was just too much. Yeah, I just I feel like I'm done. Like I've been through enough pain
You
right
have
now.
been, I know. It does look better than it did, but I know it's never going to be perfect for you.
I was really pissed about how much I should have had done and I didn't have done because I wasn't strong enough to tolerate the pain. So recently, I called Dr. Lee and asked her if she was willing to do more, and she said she would consider it.
Hello. It's been a while since I've seen you.
Yeah.
Thanks for coming back all the way over here, huh? I'm gonna take my mask off. As you know, we can do that here.
I am really super nervous.
Well, don't be nervous. Look, hey, it's just so nice to see you. Let's talk first. Let's talk first, okay? Remember, we're just talking right now, and we'll figure something out here, okay? I saw Monica a couple months ago, and she's so wonderful, but she has a pretty big, pretty substantial nevus on her face. And even though I put plenty of numbing solution in this area, she feared the potential pain so much that I really couldn't proceed. What's going on?
The pain, it's just, was last time it hurt so bad. I was upset that I didn't have a whole lot done.
We got a good amount done that day. We did do something significant.
When I looked in the mirror, I didn't feel that I did because it started coming back.
Like, is there a specific place you want to point that out to me?
This, because it hurt so much, you couldn't cauterize it as far down as probably what you wanted it to. That part right there. And it ended up hurt here.
Okay.
I'm just really nervous because I know how bad it hurt last time. And everybody was telling me that it really wasn't that bad. And, you know, you should have stuck it out. You should have did more.
Oh, no, don't think that. It's
I feel like I failed you, too, because
no, not at all.
I didn't.
No, not at all.
I didn't have a lot done to even show any purpose for you to show other people.
That is not true.
I just don't see it in the mirror.
Right. Okay, well, let me take a look. This area right here moves really pretty well. What if we were at least able to, like, numb this well and excise this area?
I don't know what that means.
That means cut it out and put stitches there.
Okay.
It is more extreme for me to excise a large area. I don't usually like to go to that, first thing, but she's had similar things done before and she really felt that they didn't work. So let's do something more significant with her now. It will make this area a little tighter, but it's like a long way around a facelift. I think that the things we need to do is to give you as much control as you can. So let's try to do all the things that we can, like give you some numbing cream ASAP.
Yep.
So let me get my girl to get you started because I want to leave that numbing cream on as long as we can here, okay? So you get nice and numb there. We'll slather it on there.
Oh, yeah.
Okay?
Sounds
all right,
good.
I'll show them too. Okay, so hold on. I'll be back.
Thank you.
Thank you.
I'm still really nervous about everything that's going on. I'm really anxious about the pain, but I'm really happy that Dr. Lee gave in and she listened to me and after I begged her and cried that she put some numbing cream on me.
Let's see,
Just slather it on her.
I am.
I remember this not being done the last time.
But we got a lot of tricks we can try, so
yeah.
Now we know what to do with you.
We'll see. We'll see. I hate pain, any kind of pain. But I'm hoping this numbing stuff that really helped.
Okay, so I'm gonna put just a little more numbing there. You okay? I'm gonna have to administer some numbing medication into the skin. And I'm also gonna talk to her the whole time because I think she really psyched herself out the first time and this has to work today. I mean, I can't just start removing a big chunk of skin essentially and she just tells me to stop. There's no way that can happen. Okay, let's see if this works this time. Again, you shouldn't feel anything other than my just kind of touching you, okay? Okay, you just make sure nothing ever hurts, okay? I'm using a different method for removal of this growth and also pain management. You're doing awesome. Let me know if anything hurts. All right.
Right now, I'm not feeling any pain whatsoever. Like, I can't even feel my whole face.
Okay, let me put some stitches right there. The tough part is over, and I couldn't be happier. I removed a pretty large growth on Monica's cheek, and no pain from her. She handled this like a champ. I can take off that little bump right there.
Okay.
And also the one along your lip here, okay? Let me just put a little numbing there, okay? Keep those eyes closed. I'm just gonna reach up here and take a little bit from around this lip here. You're okay. You ready to see what we did? And hopefully you tell me what you think about what we did, and here we go.
Am I still shaking?
Oh, no.
Oh, yeah, that looks a lot better.
So look at it straight on. Like, you know how you kind of feel like you have, like, sticking out?
It looks
That's gonna be a little line, right,
smoother.
instead?
Yeah. What about?
I can't take off the whole thing because that would be too much stretch, right? Okay. See, you're always like, what about this?
No, it's just, I'm wondering, like,
yeah, I know.
It's a real confidence booster in me. Looking at myself in the mirror this time, damn, she really smoothed it out and took a huge chunk out of my face. Maybe she's onto something. Maybe my face will get better. So, there's hope.
I think this looks really a lot better. I'm
Yeah.
very happy with this.
It does.
So I'm glad you came back.
Yeah.
And I think we're in a good direction now.
Yeah, me
Okay?
too.
It was really nice to see you again.
Yeah, good seeing you
Okay,
too.
stay out of
Thank you.
trouble. Of course, of course.
I'm very proud of myself for doing this. You know, I talked Dr. Lee into using the numbing cream on me, so then I was able to do a lot more. I was crying and nervous before I came into this, but I finally grew some cojones and did it. Last time I left very disappointed. This time I am leaving more hopeful.
Previously on Dr. Pimple Popper.
It started as a little bump. Recently, I was sent to pick up a passenger.
Good morning. Thanks for picking me up.
Turned out to be Dr. Lee.
The last time I saw you, you were taking me somewhere in a car. That was such a serendipitous moment that we met each other.
True.
Okay, there's this piece off.
Oh, yeah.
Oh yeah, huh? Now I want to address something. This bump that you have here, I suspect is a type of skin cancer. David came in a few days ago to have his rhinophyma treated, but I did at that time notice a very suspicious growth under his right eye. I think it could be skin cancer. I didn't want to alarm him while we were doing the nose surgery, but I did inform him after we completed that procedure, and so we took a biopsy, and he's back here for us to discuss the results.
Love you.
I brought my daughter with me this time. It's nice to have a little backup.
Thank you, sir. My dad basically called me and said he's going to have a surgery and I needed to come down. So I immediately jumped into action to be with him, see him, hopefully get some good information.
David?
We may not see each other very often, but, you know, we do talk. You know, your dad's your daddy, no matter how old you are.
Hi. Hi. How are you?
Hi.
I know this guy.
Yeah.
How are you? I'm Sandra.
I hear wonderful
Dr. Lee.
things about you.
Oh, thank you.
I'm very thankful that you just happened to be in the car that he was driving.
It wasn't that. It was like a kismet.
That's what I told him. I'm like,
was
it had
crazy.
it meant to be, for
Yes.
sure.
Well, when I saw him and was talking to him about his nose, you know, you can't help but notice that. But I, as a dermatologist, also couldn't help but notice this area because we train to look at all these unusual bumps on people. So I was pretty suspicious of that area there.
Yeah.
And so we took a biopsy the last time when we did this procedure here. And so I have the results today, okay? So let's talk to you a little bit about it, okay?
Okay.
What you have here under your right eye is a basal cell carcinoma. Okay, this is a type of skin cancer. Okay, I know the C word is a scary word. The best course of action is to remove it when it's as small as possible. And I know you've told me that that's been there maybe I pushed you to 2 years, but I'm gonna guess closer to 6 or 7 years that it's been there. And it was smaller before, perhaps. So we want to remove this and leave as much normal skin as possible.
What David has under his right eye is a basal cell carcinoma. It does not really metastasize or spread to other areas of your body, but it is locally destructive. So it is something that you want to remove because if you let it grow to a large size, it could impinge upon your eye. It could take over your nose. It could take over part of your face. So even though it wouldn't be something necessarily that could threaten his life imminently, it is something that you need to remove.
So the ideal treatment for this is something that I do. It's called Mohs micrographic skin cancer surgery. So I'm gonna take off what we see there and about 1 millimeter or so of normal tissue around it. So by doing that, we take as little view as possible. All right, so I'm gonna get started. Let me get my girls and we're gonna set up the room. We're transitioning to Mohs surgery day today. Okay? All right, I'll be back.
Mohs surgery is really the best technique to remove basal cell carcinomas or squamous cell carcinomas, which are the most common type of skin cancers on the face. And it's really about tissue preservation. If a skin cancer is more extensive, it's gonna take a longer time. In fact, there's sometimes when you're with a Mohs patient all day.
What you thinking?
I hope everything goes well and it gets gone.
I'm too for that.
You should not feel anything other than us touching you.
I'm now going to remove the visible part of the skin cancer and take my first layer, meaning that I'm going to take as little as I can to help minimize the size of this surgical defect and minimize the potential scar.
You're doing awesome.
When they took it off, it was about the size of a nickel. It was kind of big. I wasn't expecting it to be that big, but it was kind of unnerving. Don't want to see inside your dad, you know?
Rachel places the tissue really carefully on a glass slide. Then the tissue is placed into a cryostat so that she can slice it really thinly. It's sort of like a really high-tech version of the meat slicer that you find in your deli counter. So instead of slicing smoked turkey, you're slicing tissue.
So I look at all the edges and down underneath to see if I can see any residual. Ooh. He's clear on the edges, but down deeper, there's a little bit of a deep component right in the center here.
So David's first Mohs layer looks pretty good. There is one little edge there that looks like there's still skin cancer there. So I am gonna have to take a little bit more for him. And that is a little concerning to me because anytime you take a little bit more tissue, there's a risk for more nerves or vessels to be cut.
All right, let me just mark that out and have her process this, and then hopefully that'll be it, okay? I hope it's negative.
I am looking for darker blue cells that are really close together. There's palisading of the cells where they're all kind of lined up along the edges.
Got all my skin edge good. I see a little bit of muscle there. Well, the good news is second time was a charm. You're all clear now.
He's out of the woods. He's cancer-free. I'm pretty excited.
All right, it's all bumpy today. Tomorrow it's gonna look a little flatter, but it takes a little while for this to fully heal up. I mean, I see the potential, but usually, you know, I gotta make sure the patient knows that. It looks really good.
Yeah. Oh, yeah.
Looking good.
Way better.
Yep. Give me a smile.
I'm so glad that I was able to get rid of David's rhinophyma and also get rid of this skin cancer that he has. He's gonna look so much better once all of this heals.
Thanks for letting me work on you there and dragging you back in, and I'm glad I could give you good news about it. And I think we got it. We have 98% success rate with Mohs surgery, so we probably got it.
I feel like Dr. Lee is a genie, and she popped up and granted all my wishes.
Thank you so very much.
Welcome. It was nice to meet you.
And I'm very thankful that she just happened to end up in his card. If it wasn't for that, I don't know what he would have done.
Let me have the shredded beef, and I'll take a Sprite.
Excellent.
Since the surgery 6 weeks ago, everything's gotten better. You know, he looks normal. You know, I'm quite happy with it. The one on my eye here, Dr. Lee did a really, really good job. The cancer's gone, and knock on wood, that'll stay away.
My name's Aziza. I am 26 years old, and I have a lump on my wrist. I started noticing my lump maybe about 6 years ago. I actually thought it was a bone at first, but it just got so big that I was like, this can't be a bone. I'm really excited. I'm going to meet Lauren today. So Lauren and I met a little over a year ago. We met on the internet in a Cysts Facebook group. When we both found out that we had a cyst on the same wrist, I was like, oh my gosh, we're sisters.
I'm really excited that I'm gonna get to meet Aziza today. It doesn't seem real almost. We've been talking for like so long and I'm almost sad to get rid of the cyst. It's been like such a bonding thing for us.
Lauren's friendship means a lot to me. She's really been encouraging and just really supportive.
Aziza is exactly the same person that I've always thought she was. It almost didn't feel like I was meeting her for the first time. Come on. To my house.
This is so cute. Oh wait, I didn't even say hi to your sis.
I know.
She's cute. Mine's bigger though.
The biggest issue is the pain. It's like a dull, achy pain.
I'll feel my hands kind of tingling because it's starting to make my hand numb. Is it weird when I touch it?
No.
Ew, don't grab.
It feels the same as mine. There are certain things that I have a hard time doing. Carrying groceries.
Trying to carry trays, picking up my kids.
Wait, squish it. Ew.
Ew, that's so nasty. That is nasty.
I'm definitely feeling way less anxious now that Aziza is here and I feel so much more comfortable.
I'm ready to get this lump removed. I'm ready to get it taken care of.
Well, hello. Look at you two.
Hi.
Two beauties in here. Hi. Are you both my patients today?
Yes.
This is like a package deal or something, huh?
Yes.
We have Lauren and Aziza.
Yes.
Lauren.
Lauren and you're Aziza?
Yes.
Welcome.
Thank you.
Are you guys friends?
Yes. Yeah. We met online.
You met online?
Yes, and now we're in this great sisterhood.
Oh, you guys are all, you have matching
match.
bumps.
Yes.
You guys have like literally matching ones.
Oh, we fist bump too a lot.
Yeah.
I keep making her do it.
That's so cute. These two women who met on the internet, they are the cutest things. It's as if they've known each other for years and years, yet this is the first day they've ever met in person. It's very unusual to have matching bumps. And I think that Cysts really brought them together. They are truly sisters. This most likely is a ganglion cyst, okay? With these types of cysts, there's kind of like an oil, like a lubrication that allows our joints to move around. It's sort of like a hair gel kind of substance. So what's happened is, for some reason, that some of that gel fluid has found its way, like to create a little bubble on the outside. Ganglion cysts are pretty common. Actually, they're not really dangerous in any way. Sometimes they cause you pain, maybe because of the size of the cyst is kind of pushing down on a nerve. Also with these types of cysts is that they are connected to right between the bone. You know, they're down underneath there, deep. And that's a little too far for me as a dermatologist to get to. A lot of times when my patients have them, a lot of us dermatologists can either refer them directly to, like, it's usually orthopedics or a hand surgeon, like a specific hand surgeon, because what you want to do if you want to get rid of it definitively is to go in there and seal that connection. What we can do though is kind of like pull some of that fluid out and flatten it, and hopefully it will go away.
I'm really nervous about the idea of having to go get another procedure after this one.
Yeah.
Especially if Aziza's not
I know,
with
okay.
me.
That was a little disappointing, but she did say that she can actually go in and remove the fluid from the cyst, so we won't have the same problems when we leave here, so that's good.
All right, so you ready?
Yes.
Okay.
I was hoping I could ask to keep them in a jar.
We'll give you a little biopsy bottle and maybe you could tie that. It's not gonna look that cute, but.
I don't care.
And I just love how cysts bring people together.
I know.
I'm ready. I'm ready to get this done. I'm excited.
My Xanax has kicked in.
Okay, here we go. I'm
God, I'm so scared.
Oh, no.
Oh my God, your face.
What's wrong with your face?
This is so good. Oh, you're freaking me out. Stare at you.
Good, stare at her, stare at her.
Stare at you. You did good.
See, we're just doing it now.
I wish I could watch.
Do you want to see what's in it? Open your eyes.
Is it done?
Open your eyes.
Yeah,
yes.
yeah, you can
Open your
look
eyes
at it.
first.
Whoa, it's
gone. And then here's the gel.
Cool.
It is.
I
Isn't
thought
that like
there was
hair
gonna
gel?
be more. Just to see the lump there 1 second and then just like flat the next second. There's no extra skin there or anything like I thought there might be.
You did so good.
Yes, you did. You did awesome. Come on down, sweetie.
I can't believe how quick and simple it was. I am a little worried about it potentially coming back, but hopefully it won't.
I have to say bye to it. I'm sorry.
Oh, yeah, go ahead.
Goodbye. Goodbye, Cicely.
Okay, you ready?
Yes, I'm ready.
Okay, so we're gonna put a little incision right there, but you shouldn't feel anything, okay?
Bye. I'm so sorry.
Miss you.
It was me or you.
Okay,
gel.
this is yours.
Okay.
And this is yours. And you guys are gonna, like, this is a pact, not instead of sharing your blood.
Oh my
Just
gosh.
don't stab me, because then it will be blood.
Oh my gosh.
Boy, yours is just going, isn't it?
Look at it.
Just like she said, it looked like hair gel or something.
I loved it.
Yeah.
It was super satisfying. Like, oh my gosh, it just looked so cool coming out.
I kept some in a file. It's both of ours, so now they can live together forever.
There's no telling how long the area will stay flat. They may have to see a hand surgeon in the future to get rid of it completely, but I'm so glad I got to see them first. So nice to meet you both.
It's really nice
I hope these never come back.
I know.
I am a little worried about it potentially coming back, but we're always gonna be sisters.
Sisters without the lumps.
My name's Johnny. I'm living in Tallahassee, Florida. I'm 62 years old, and I have psoriasis. I got it all the way from the top of my head to the bottom of my feet. It's all over my arms, all over my head, my stomach here, it's on my legs, it's on my foot, it's everywhere. My skin feels real dry, and it's cracky all the time. It's itchy all the time. And I might scratch my leg for 3-4 minutes just digging. If I scratch myself raw, I have to sit there and let it cool off. My psoriasis started with a pimple on my head in 2002. I busted, and some green stuff came out of it, and it kind of scared me, so I went to see a nurse about it, and she gave me a bottle of holy water. That didn't work. So I finally seen the dermatologist in 2017, and he told me that I had psoriasis. He gave me these two little mini tubes of cream. I gave it a try, but it seemed like it didn't slow nothing down, so I didn't get to see the dermatologist no more. Yeah, every morning I wake up, this is how the bed look. Scratching is a 24-hour job, because they don't give you no break. Me and the broom is pretty good friends. It's peeled off all the time, and everywhere I go, if I'm there 5 or 6 minutes, there's gonna be some skin, and then I'm gonna have to sweep the floor up.
Well, hello, sir. How are you?
doing?
Hi, I'm Dr. Lee. It's really nice to meet
Yeah.
you. Welcome.
Johnny, thank you.
You came a long way?
Yes, ma'am, from Florida.
Well, it looks like you got some chalk on you.
I got psoriasis
When did it start?
in 2002.
Okay.
There was a pimple right there. Kept scratching it, so I got tired of scratching it and squeezed it.
And then it just started to go other places?
Everywhere.
Does it hurt?
Oh, yeah. It's either itchy, stinging, or burning. Every time I scratch, pile of flakes on the floor.
Probably pretty frustrating.
Yeah.
This is one of the worst cases of psoriasis that I've ever seen. I mean, he's got plaques as white as snow. So Johnny did have a spot on his forehead that he thought was the start of the psoriasis. It may have been the start of psoriasis, or it might have just been a plain old pimple. But I'm gonna have to take a close look to know for sure. Let me see your hands first, your fingernails. See, you have these little, like, pokes in them. And then you have these plaques that are covered with this kind of white or gray scale. We call it micaceous scale on top of it. You have a little bit that you scratched off so hard that there's blood there.
Yeah,
and I can see this one's real thick right here.
Yeah.
On your back, do you have anything going on?
It's down here.
I see, yeah. You have it on your tush. And let me see your chest here. All this is where you used to have it?
Yes, ma'am.
Really? And how are your legs? Are we able to see any that you can see the flaking?
Yeah.
Scratched up?
Yeah. Did that this morning.
Seeing Johnny's skin up close, this does indeed look like plaque psoriasis. He has a good number of these plaques and they're really flaky. But you also see areas that are a remnant of the psoriasis that he's had before. Subtly darker shaded areas. You know, when you have trauma to an area, you can have a little darkening. Also, one of the things that I check with people when I'm suspecting psoriasis is to look at their nail plates. Because if they have something called pitting, it's like little ice pick kind of pokes in your nail plate, and that also helps to kind of solidify the diagnosis here. Okay, so the good thing about psoriasis is it's not threatening your life in any way. This is not contagious. I can touch it with my hands. I'm not afraid of catching it. You know, it's not like something that you can pass on to somebody else. But it can cause you to be really itchy and miserable, and also affects your well-being. You know? What we have found is that there are these medications that can be used to treat psoriasis. They're actually injections that can calm down your T-cell system, which is your immune system that is used to fight off conditions. So the medication I'm thinking about using is called ustekinumab.
That sounds like foreign language.
Yes. Hopefully you should start seeing a difference even in a month or so, but you got to continue doing it because if you stop, you'll probably start to go back to where you were. What do you think about that? It's worth it?
That sounds great to me.
Yeah. Stop! Don't scratch it!
You the first doctor even sat down and talked to me this long.
All right, so you think you can give yourself an injection?
Oh, yeah.
All right, I will see you in a little bit. Okay?
All right, appreciate it.
Of course.
Well, this is the best Dr. Visit I ever had because Dr. Lee, she took her time and talked to me, explained my situation to me.
All right, so this is the ustekinumab. I'm gonna show you with one injection today, and I'm gonna let you do it, because you're gonna need to do this like every few months or so. This medicine, it works really well and with many cases of plaque-type psoriasis. Some injections are self-administered in the abdomen or on the thigh area. And there's a cushion there. There's a little layer of fat there to protect yourself, so you're not gonna just inject that right onto bone. Take an area here, and you just go like that. Just go right there, go. There you go, and now push it in. That's it. You did it. Look at that. There's no guarantee with these medications, but in a couple of months, we should know whether this is working for Johnny. Here's your prescriptions, and then we'll see how you do.
All right, I appreciate it.
Of course. I look forward to seeing you getting better.
I feel like a miracle. Seems like somebody paying attention now, you know. Yeah, I'm leaving here with a lot of hope and confidence because, you know, I believe that in a month or so, we'll be able to tell the difference in knowing that the medicine working. It's been 2 months since I seen Dr. Lee. Dr. Lee gave me the real magic potion. And my skin looked great on all the different parts of my body. It feels almost like regular skin, and compared to it used to feel like concrete. Now I'm not leaving flakes of skin everywhere, and I can actually work instead of scratching.
Hey, Dad.
What that you broke?
Ice cream.
My daughter Angela is my sunshine, and she's the main reason I want to get better.
Do you look like a different man?
That's a good thing.
Yeah, it's a good thing. I don't see anything on your face. You look good.
Mm.
And that means we can go to the mall. You know, you can buy me some shoes, pay for this stuff. My dad's skin looks better, and he don't have to scratch, and It's nice to know that he won't have to go through that pain anymore. I feel like he knows that he's a new person. Okay, are you ready to do the dance?
Rising cleared up so much, it's turned me loose, you know what I'm saying? I really feel like I can move and dance.